So now is a chance for everyone out in the world of Zoom to start submitting any questions. Kavitha and Phil are going to come back up, some key takeaways from the day, and start submitting your questions in the Q&A section. And answers to the questions about 2030 and beyond are actual realities. So if we can, for the round of applause, Kavitha and Phil, come on back up.
Think we don't need the podium, but either way, this is going to be a discussion on, again, a continuation from the last panel on what actions we're all going to take after leaving this room today. I think I've had a lot of wonderful discussions and conversations, even outside the panels, that's been very inspiring. I think especially the community-based organizations are very passionate, and I loved David's thoughts on the panel and more that he wanted to share. And especially the patient-centric or person-centric approach that partnerships with community organizations create. I think that's the synergy I'm seeing here. As even one person who was leaving the room mentioned, she hasn't had a chance to have such diverse group of members in one room before, from community organizations, hospitals, and health systems in one room. So I think that by itself was a key success for us today. I think some key takeaways for me, number one, definitely I cannot skip Commissioner Daniel. The rules she shared with us, and the rule that I'm not going to forget is we are not done yet. I think there's a lot more work ahead of us, but I'm very excited with all the changes and the opportunities ahead with funding models, but also more and more interest from the two groups to work together to integrate medical and non-medical care. I think there's a long way ahead, but I'm seeing step-by-step progress, even from the very limited years I've been in this field in the last few years. I've been to a conference called US Aging. I think Christina has been there too. And I keep reporting metrics on what percentage of community organizations work with healthcare, which is slowly, steadily increasing year over year from 30% to 44%. And I truly want to see the dollars behind it. How much dollars actually flow into non-medical care, and how is that changing over the years? So very excited for this discussion. I'm mostly interested in hearing from you all what stood out for you today and what actions you're taking. But Phil, you want to share first?
No, let's hear with them first.
Awesome. Anybody who wants to start? Thank you, Victor.
Hello, everyone. I'm Nico Hunt. I'm with Texas Health Resources. I'm a program manager for community engagement. And being in public health for almost 8 years now, I'm a little biased because I am a community health worker. So my key takeaway, and I've heard someone mention it today, I heard a stat that said if a hospital would hire 3 community health workers, it could save them $4 million a year, right? So my key takeaway is use the people that you don't think about on a day-to-day basis, like a community health worker, because we are boots on the ground. And sometimes even in my current role, I go back to that cultural humility when I'm working with folks. And granted, I'm on the stakeholder side. I also know from the community member side of what they need. So letting them be the experts of what they need in the community and bringing them to the table in those focus groups in places like this so that they can also hear what's happening in their community, and then they can maybe be those change makers, right? Sometimes just because we're in this profession doesn't mean it's the end all be all, right? Sometimes we do need to go back to the basics and just include the people in the community. What do you want to see that's going to benefit you? You know, is it really just about food? Is it about healthy food? Like, what is it that you need? Dig a little bit deeper. So, and utilize your community health workers, because that's what we're here for.
Awesome.
I just wanted to second that because our entire community health team at both UT Southwestern and Parkland are all community health workers. And we've actually integrated them into a lot of our research studies. And I tell people it's a lot easier how to teach a CHW to draw blood than it is to teach a phlebotomist how to talk to the community. So yeah, I mean, I believe CHW should be doing everything up to the very top of their skill set because they're just so good at almost anything that we need to do in the community setting and addressing the non-medical drivers of health, knowing where people should go. You know, if you get into 411, find help, like, oh, I have this person that has a need, 90, not 90, 50% of the time, the information in find help is wrong. But the community health worker is like, oh, no, that's not right. You need to go here instead and go on Tuesdays. And, you know, you can't take that human out of the loop completely.
Great, thank you. I want to hear actions. What actions is anybody taking?
So my key takeaway today is we do nothing by ourselves. Everybody that knows me will tell you like I'm very inclusive when it comes to collaborating. In my mind, everything works. You can ask Nico. I always say we're not going to say no at any discussion because then at that point your brain is instantly going to figure out the different ways to get over those obstacles. The action that I'm going to take is I sit on two different boards and I'm just going to challenge them to really see what impact can we make. I don't necessarily want to hear a 3 to 5 year plan because people need to eat now, right? People need resources now. So how can we take little steps, but intentional steps on making progress every single day?
And I'm the president of one of those boards he's talking about. So thank you for that challenge.
Need a plan for a long board meeting. All right. Anybody else? I have an action suggestion. I think a lot of you all work in the community doing addressing non-medical drivers, but as many panels talked about them, like ROI, linking things to the ROI of or the impact of your work. I think it's very, very important. Often you're doing the work, but not realizing the things it's impacting. Amazing example. I was just talking to Dallas County Weatherization Program member here, and I was just reminded that when the county social services or department is doing the weatherization program, you're actually preventing things from happening because you're giving people those weather alerts. You're giving people the resources to stay in their home safe during that weather event, which reduces the number of people showing up in ED after that weather event, whether it's a snowstorm or a rain or like other events that are causing it. But I don't think people are connecting those two dots. And I think that's an important case to make when you're requesting your budget, when you're collecting data, when you're reporting data, when you're talking to your healthcare partners, and thinking about how do you actually measure that value together in pilots, and how can partners like us support you for sure. But also regardless, I think it's an important point to think about what are those programs that you're doing in silos without that connection to the care impacts that it's having in your community. All right. Anything else to add, Phil? Eric? Great.
But I think Victor wants to add more. Did you raise your hand? I would add the suggestion I made earlier from an action item perspective is I would love to, because I think if you get into a local area, a county, even just one county, even smaller than a county, could be a city, and you get one health plan, one hospital system, a community care hub all together to try something and agree on what the value is to each one of them in this process and then to measure that value, it'd be a very interesting project to come out of. Because from that project, it could, not to self-plug here, but it could bloom into something much bigger and go to the county level and then ultimately to the state level and then even further. But it would be a great opportunity because, you know, I work a lot with health plans. I know their hesitance to pay, right? Because they want to link it to an actual clinical outcome. But we could do that if we all sat down together and said, this is how we're going to accomplish and align everyone's incentives to work the same way. I think we'd discover a lot of things. So my action is I'll be calling on a lot of you to figure out how we accomplish that, because we can help bringing the health plan and other people together, other people that may not even be in this room right now, to bring them to the table to actually accomplish a unified goal amongst all the healthcare constituents in the area. And I consider the non-medical community-based organizations still healthcare constituents in the world we live in now. So that'd be my action item, Kavitha.
All right, everyone. Thank you so much. Kind of a round of applause for Kavitha and Phil real quick. So I want to thank everyone live streaming in Zoom. Thank you for joining us. Next slide will show you our QR code to share any feedback you have about our solution. It'd be interesting information for all of us to have. I want to thank all of the speakers that are still here and not here. A round of applause for all the speakers today. Thank you so much. I want to give a big round of applause for the Blooming Health team that put this all together. Well done, everybody. Marina's in the back, Phil and Kavitha, Jen, Ramses, me, and Jess. Thank you all very much. My name is Eric Kaplan, and we all have a great night. Last thing is that we will be over at the library having happy hour in a little bit. So feel free to hang out and do some networking here, and then make your way over to the library bar that's right in the lobby of the hotel, and we'll keep on talking over there. Thank you all very much.